In this fashion, what direction is the rib moving? What are the ribs on the right side doing?
Anterior.
Yeah, the ribs on the right are going anterior, the ribs on the left are going? Good. If I side bend Scott this direction, these guys are elevating, these guys are depressing, right? So I'm going to use thoracic motions to create rib motion. Okay? We could get really, really fancy. We're not going to do that. Isn't that good? We're not going to get fancy. We're going to get into this mode of thinking about rib motion as being a rib that's going anterior, right? A rib that's going posterior, a rib that's coming up, and a rib that's going down. Okay, so we're going to think about it in just those kind of two planes. The other plane is sagittal, and we're looking at torsion. Torsion is an important motion, but it's really hard to palpate and to create that passively. So we're going to create it. We're going to look at primarily focusing here now on the transverse plane, and what we're going to call that in rib language. Transverse plane motion in rib language is anterior or posterior. So that rib is either anterior or that rib is posterior. Pretty basic, right? Transverse plane. So really, think about it, the ribs is kind of an extension of the transverse processes, because that's really what it is, right? When I rotate to the left, what's the right rib going to do? When I rotate to the left? Anterior, left, posterior, just like the transverse process. When I side bend to the right, again, frontal plane, that rib's going to depress, the left rib is going to come up. So we're just thinking about those ribs moving anterior, posterior, elevation, depression in the frontal plane. So that's what we're going to really kind of, how we're going to approach it. So just like we created motion in the thoracic spine, I'm going to have Scott with his hands across the chest, and I'm just going to create rotation. So as I'm creating this rotation, these ribs are going to go anterior, right? So I'm in here. My recommendation with this is starting at the 10th rib because it's the easiest to feel. Start at the 10th rib. I'm going to follow that rib up, and then I'm going to have I'm going to introduce you to what's called our rib mobilizing hand. This is our rib mobilizing hand. This is like, you know how when you're at the, when you have crab crackers to eat crabs, that's like the tool you use to eat crabs. Well, the tool you use to mobilize a rib is this right here, right? So we're going to kind of think about this curving around that rib. So it's like, I'm locking onto that rib, like this. Now remember, when we look at ribs, excuse me a minute. Look at ribs, they slope inferiorly. Also the scapula gets in the way, right? So, all right, so these aren't horizontal, and it's not just because this is old, but they do slope inferiorly. So here's my rib kind of like mobilization tool, right? So it's not horizontal, but it's tilted a little. I'm kind of like this, right? So why is that good? Well, it's good for a couple reasons. First of all, my thumb, you see how my thumb can push the rib forward? And my finger, depending on how big your hands are, can pull the rib back. So by this one position, I can push or I can pull. I can pull with my finger or I can push with my thumb. I'm just pulling it back or I'm pushing it forward. Okay? We can pretend to appreciate motion or we can elicit symptoms. That's really what we're looking at. The patient goes, oh, that's it. Yep, that hurts. That's it. Is pain biting in? Yep, that's it. So we would say that that patient has difficulty with that rib coming posterior. Maybe coming back too far, maybe not coming back enough. So that we need to later decide. We're just trying to find the rib that seems to be the problem. Okay? So that's for anterior posterior. So when we take this and we look at how we would do that, patient hands across their chest, I take my rib mobilizing tool and I find that 10th rib, right? There it is right there. We try to follow that up, and then there's my tool right there. So I'm in a position, you see, where I'm posterior here, and I'm going to kind of push that forward. So that's all I'm doing. I'm creating rotation. He's even helping me. And then at the end of that motion there, I'm just going, problem? Nope, that's good. I might come back, go up to the next rib. Here. And see how I'm kind of like oscillating a little bit? So I'm kind of doing this. Like I'm rotating as I'm pushing. I'm using the leverage of his trunk, of his thoracic spine to create that motion as well. And that's an easy one. I can lock on and my thumb gets a pretty good contact there, and I can push on some ribs. Now, you may be wrong in what number you're on, but that's okay, Because what you're going to do when you find that painful spot is you're going to remember that spot somehow. You're going to find the thoracic vertebra, you're going to figure out where that is, so you remember where that is for next time. So I start with where I think is rib 10, and I work my way up, but I might be wrong. That's okay. We're going to figure that out later. I'm just looking to hurt them. Right? I'm just going to try to reproduce their pain. Right? Because if I do, if they say, man, that's the spot, that's great. I just saved myself several weeks of therapy. That's the spot?
Yeah.
That hurts? Okay.
I'm not really.
Oh, okay.
I mean, for the situation.
Okay. Thank you. For posterior, I'm going to take my hand a little bit with the guy like this. I'm going to take my hand a little bit, and now I'm going to kind of do this, right? Or I may get a little bit of help from these other fingers in the front. So depending on who this is, with Scott it might be a little tough for me to do this. But I'm still in this position, I'm still using that tool, but now I'm going to kind of take that rib, and I'm going to kind of overpress at end range here. I'm going to try to pull that back. I don't feel like I'm really getting that enough, so I might just take my hand and put it in the front and just use my fingers, my reinforcement here. I'm kind of doing this and just reinforcing that hand and coming back. Okay? So with